I'm Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient of 50-year-old lady suffering from hypertrophic obstructive cardiomyopathy. She was diagnosed with it around 10 years back, and it is a progressive disease of hereditary nature. She is on cardiology care for all these years. Now her problem is very uncomfortable with breathing difficulty and dizziness and fainting attack, not able to sleep. She can't sleep in the lying down position. She's in a semi-sitting position. She is able to get a nap itself. She was advised to undergo an open heart surgery, that is septal myectomy actually. And she's complaining of discomfort in mouth and throat also. She's saying that her tongue is protruding. I was wondering, because she's having a hypertrophic heart disease, whether the tongue muscles are also getting hypertrophic, we don't know actually. And she's complaining of burning sensation on the tongue. And along with that, she's having varicose veins on the leg and sleep apnea. She's not able to sleep at all. Basically, comfortable sleep is not there, and sleep apnea is there. And in the ultrasound scan, fatty liver and gallbladder stone is there. And because of so much of discomfort, she has undergone so many investigation procedures. I'm not going into the details, only the significant ones. And the endoscopy, she is having GERD, that is gastroesophageal reflux disease also. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in periodic tests. Next, when we come into the patient details, she's a 50-year-old lady, height 159 centimeters and weight 60 kg. Body age 55. Actually 5 years of accelerated aging is there. And her abdominal circumference is 97 centimeters, having abdominal obesity. She's not that obese, but abdominal obesity is there. And her fat percentage is 35.2. Ideally, it should be less than 25. Ideally, around 15 to 25 is the ideal fat percentage for the ladies. Okay, it should be always better to keep it around 25 at least. When we come to the diagnosis, it is hypertrophic obstructive cardiomyopathy. And it is diagnosed for the last 10 years, and now she is having discomfort, all sort of discomfort. And chest discomfort, breathlessness. She is not able to do the routine activities and even to sleep comfortably. That is the situation actually. And she's having this, she's saying that the tongue is protruding, tongue burning, and so much discomfort in the mouth and throat also. And diagnosed with the GERD, that is gastroesophageal disease, reflux disease is there, that is the acid coming into the esophagus and to the larynx, and that may be one of the reasons for she is not able to lie down, and lack of comfortable sleep. And gallbladder stone. And this disease comes when we for this clinically supported lifestyle correction, we are actually correcting the body composition. So we categorize the disease into a few categories. Actually, she's having genetic. There is a genetic predisposition is there clearly, and also there is obesity and metabolic disorder is there. And also she is having some autoimmune problems, autoimmune disease. That is actually varicose vein and GERD and all comes under the maybe of autoimmune nature. Next, when we come into her discomforts, mainly breathlessness, chest pain, dizziness, acidity and gastric discomfort, neck and back pain, and also discomfort in sleeping, and also sleep apnea, and mouth discomfort and burning tongue and all. When we come into the medication, actually she's not, there is not much medication for it. Only she's getting palpitation, that is fast heartbeats. For that they had given Concor, that is bisoprolol. It is a beta blocker that actually reduce the heart rate. That is the only medication which she was taking currently. She was on other this anti-acidity agents and those things are also taking that. That is not that significant, that is why I am not mentioning this here. When we checked the blood test, also there is not much of the abnormal parameters in them. We do a detailed test study all itself. And in vitamin D was reduced. Nutritional point of view, vitamin D was low. And also her cholesterol was high, because a cardiac patient also cholesterol is high. And troponin was high. That is actually troponin test is done to see there is any problem with the cardiac. Actually it shows the cardiac muscles are damaged. That is an indicator for a heart attack also. For the cardiac patient heart attack, when we come to diagnose a heart attack or confirm a heart attack, what we do is troponin test. So if you get heart attack occurs within 2-3 hours, usually the troponin will become positive. For her, there's not an attack. Actually, she's chronic. The heart muscles are under chronic ischemic change. That is lack of oxygen and lack of blood, because it is thickened. So much of thickened, and the coronary artery is not able to give sufficient nutrition to the, maybe because of that, or maybe that is turnover of the muscle cells or something is creating her troponin level is high. Next is echocardiogram. It is diagnosed as in the echocardiogram itself hypertrophic obstructive cardiomyopathy with a moderate MR. MR means mitral valve regurgitation, and also dilated left atrium, because the mitral valve is incompetent. The atrium, the upper chamber also getting dilated, and mild aortic regurgitation, and the valves are damaged, actually mild pulmonary regurgitation. So the cardiac valves are damaged, and also the cardiac hypertrophy is there, and atrial dilatation. And abdominal scan shows fatty liver and gallstone 20 into 5 millimeters. Not that big, but stone is there. When we come to the clinic, this is the patient profile, and when we come to the treatment aspect, this is a hereditary disorder. It's a hypertrophic congenital hereditary cardiomyopathy. That is the name itself. Then what is the role of lifestyle correct modulation in such a disease? That is what we should understand. So generally speaking, there is for this patient actually there is no option actually. This cardiac surgery which is advised is an open heart surgery. So this sternum, the chest wall has to be opened and the heart has to be exposed. Then the heart has to be cut, and it's a major, even it is much major surgery than a bypass surgery, because bypass surgery you are not opening the heart actually. You can only manipulating the or doing a bypass on the coronary arteries. The coronary arteries are traveling the periphery or the outside of the heart actually. So this you had to cut open the heart muscles itself, and you're trying to remove a part of the muscle. So it can give so much of complications. It's a very dangerous surgery itself, and also the result you cannot predict. You can have there is a very good chance that is on the table, or immediate postoperative complications and even death. So that one aspect. Another, she was advised for that surgery, and so that is why she came and tried for a clinically supported lifestyle correction, and she wanted to try this. So there is no option also. And in clinically supported lifestyle, what we can do in this sort of patients, because her heart is compromised, so reduce the heart workload. That is the primary focus we are doing. She's slightly overweight patient, so she can, what we are trying to do to help her, is to reduce her body fat and bring her a BMI to low normal. For her BMI is 23.7. It is only slightly high for an Indian. An Indian, its ideal is maximum BMI is ideally is 23 only. Generally, it is for the Caucasian Central we generally consider 24 is the ideal or maximum. It's not ideal. The people think that that is the ideal. It is not correct. Actually, for the generally 18.5 to 25 is considered as the range of BMI. That is actually depends on how much muscle you are, how much activity is there. If you are in the lower activity range, you should keep your BMI also to the lower low normal. That is for the Indian, it is 18 to 23 is the ideal. So what I want to make her comfortable, we are trying to reduce her 18 to 19 ideally. That is actually we are intending. So see what is the benefit out of that. And also she is having this varicose vein and also fatty liver. Definitely varicose vein will definitely reduce. That is our experience. Even the varicose ulcers all can be corrected with this lifestyle modulation. So, and also fatty liver. That is, if she is able to reduce the weight, definitely reduce the BMI, definitely fatty liver will be gone, and also gallstone size will be reduced. So, in the clinically supported lifestyle correction, what we are trying to giving is actually nutrition, basically. To this weight reduction or the fat reduction is needed. It's a low calorie diet, but ensuring all the nutrition in the food, and also to reduce the toxins entering the body and increase the activity level. So this is a cardiac patient, she cannot do much exercise and all. So it's in the lying down position. This is the special exercise called oxyflex actually. It is designed to in a segmental manner. The exercise is done in a segmental manner, so that it will not exert the heart. So that is what is given. And that what was the result? So by the 8th day itself, actually her breathlessness, chest pain, dizziness are all reduced almost 50%. And the acidity and gastric discomfort and neck pain, almost 80% is gone by the 8th day. It's only within 8-day result, and she is able to get comfortable sleep also almost. And by the 15th day, the only symptoms, the acidity and gastric discomfort slightly there, 80% is relieved. Breathlessness is also around 70% relieved. So she is comfortable by 15th day. Even 8th day, she is in a much better position. By 15th day, she is very much comfortable. And 30th day, she is almost clear. Almost slight breathlessness when she is climbing step, and that's all. Otherwise, she is comfortable. By 60th day, there is no symptoms at all. And about the medication, she was taking not much medicine. The Concor was the regular medication. And Concor itself, that is a beta blocker because of this palpitation to reduce the heartbeat and all. So it was 8th day itself, it was reduced to half. And by 15th day, it was reduced to half tablets SOS. That SOS means if any palpitation comes, she has to take. But she never had much of the problem, and she was not taking this beta blocker at all. And when we come to the blood reports, and vitamin D was low, but it is by 30 days itself, it is 28, it has come down up to 47. And the dyslipidemia, cardiac patient, dyslipidemia is significant. So it also came down by the cholesterol was gradually reducing. By 90 days, the cholesterol came down, and the triglyceride and all the parameters are okay. A slight increase in the HDL, we don't consider it significant at all, because that's a calculated thing. So if the triglyceride and HDL is okay, then itself the problem is over. Troponin level, that is a cardiac marker. That is, troponin means it is a protein oozing out from the cardiac muscles. So it is usually taken as a indicator of heart attack actually. For her, there is no heart attack, but there is damage in the cardiac muscles. That is why it was high. It's not that high actually. For the cardiac, if it is a heart attack and all, it can be even thousands. It can come in 3,000, 4,000, 5,000 and all. But it is only slightly elevated. It shows that there is a chance that there is heart attack can occur. And initially it was 28.2. And in 5th day itself, it is came down to 26.5, and gradually it was reducing. By the 15th day, it was 19.7, and but after that, actually, it was slightly increasing. Maybe because of the resorption, we don't know. I'm not able to explain why it is slightly increasing and why it's slightly decreasing. And initially it has come down, and then it was actually slightly fluctuating, and by 180 days it come down to 15.6. Actually it is normal, I think around less than 13 or something is normal. So it is not that high, but it is also that the troponin level also is showing improvement. And when we come to we are trying to correct the body composition, and through that the immune system and the hormone system we are trying to correct. Actually, blood pressure and the cardiac activities depend on basically neurological and hormonal activities. Next is when come to what are the changes in the body. So we had this dramatic improvement in the symptomatic relief was there. What is the reason for that? Actually, she's having GERD, that gastroesophageal reflux syndrome. So that with the change in the food habits itself, usually that is all very fast relief will be there. So that may be adding for our cardiac discomforts also. So maybe one that thing. And then when the changes in the body, what are the changes in the body actually? Her weight was initially 60 kg. She was not that overweight, only 23.7 was her BMI. And it was gradually reduced to 54.8 by 30 days, and by 90 days it is around 50 kg, 49.9, and by 180 days it is 48.4. So around 20% reduction is there. So if the patient adhere to the protocol strictly, they will be able to achieve this same thing in 90 days itself. So, but it's okay. By 180 days at least he reduced to 20% fat reduction. And that the weight reduction, simple weight reduction also won't help. That fat has to be reduced. In this clinically supported lifestyle modulation, what we are aiming is to increase the muscle and bone and reduce the fat. So her initial fat percentage was 35.2, and we are come down. It was come down to 27.8 by 180 days. Ideally, we had to keep it below 25. For her, it is a must, because she cannot tolerate too much of because when the body size is reduced, the heart workload is reducing, and also many of these hormones, so many hormones are actually controlling the heartbeat, BP and heartbeat and all. So if it is in the relaxed, it is in an optimal way, the cardiac activity also will be heart workload also will be reduced. That is what we are aiming for. And her abdominal circumference was initially her abdominal obesity 97 centimeters was there, and she is able to reduce it by 180 days to 72. So that much difference is there, that so much of fat is gone. And initially her BP was 110/70 with this beta blocker also, but without any beta blocker or antihypertensive medicine, her BP was perfectly controlled. And that is actually the body composition changes, and it is actually helping her. Even the cardiac heart doesn't have to work that much. When it is 60 and 48 is entirely different. And actually, we are ideally she can come down to around 45. That is what we are, or 45 kg, or even if you can 48 also, she should keep her fat percentage should be less than 25. That is what actually we are advised for her. So what is the future? How she should be managing herself in the future? So usually we give a continuous monitoring for the 180 days, and after that intermittent every after 270 days, that is 9th month, then 1 year, and then depends on the patient's problem, every 6 months or yearly follow-up. That depends on the patient. So for her she is comfortable, not symptomatic at all. So she is advised for a yearly follow-up only is needed. And in between she has to check her troponin level in between. So troponin level, if it is reducing, that is making us very comfortable, and keep her weight around 45 to 45 kg, and body fat. Ideally for her height, her abdominal circumference should be less than 70. Around 65 will be ideal. If she can come down to that, she will be perfect shape also. So That is it, and it is the very. I was also very impressed with this clinically supported lifestyle correction for this patient, because it's a hereditary problem. So I was also not expecting this much relief for this patient. So it was a surprise for me also, that total relief in the symptoms for a hereditary problem actually. So even that repeat echocardiogram may not show the complete thickening, complete correction of the this muscle wall also. That is one repeat echocardiography was done, but there is some reduction in the thickening of the, that's all. But the symptomatic relief is tremendous and the patient is comfortable. That is the most important. And if she is able to maintain this, she will not be having much problem at all, I think. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Lifecare Center, Devara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and There are too many diagnostic and treatment modalities with many side effects. Awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.